Okay, does anyone else have any? Oh, sorry, go ahead, Miss Voss.
Yeah, I was just going to say, I think it also depends on where the children live. I mean, a lot of families are very scattered these days, so it may sometimes fall on the children who live closest to the parents. So I think that could be a factor as well.
Okay, what is important to you when seeking, or if you were to seek care for your parents? What about you, Miss Gutierrez? What were important factors in your decision?
Well, I haven't had to have let them in care, but if I had to make that decision, I will probably base it on their well-being. If they have a physical or health issue, that will be the primary concern.
Okay,
And I
and
will probably also consider the financial implications.
this question's for you, Nancy. What would you value? What do you value in a caregiver?
I would say the quality of care, the thoroughness, communication skills, and expertise, um, compassion, and experience and affordability would factor in, but mostly I'd say the experience and expertise.
Okay, and this goes back to everyone. Are there any other particular attributes you'd look for in a caregiver or a care providing service?
The disposition.
I'm sorry, can you say that one more time?
The disposition for him to help and make him happy and comfortable.
It's an Alzheimer's. If the parent has Alzheimer's, my mother-in-law has Alzheimer's. What was very important to us was that the Alzheimer's wing was a separate, secured area that the patients aren't able to get in and out without knowing a password, which they won't remember. But we wanted to make sure that they had to stay in that locked area at all times. So that was very important.
Okay, and do you know if if you have already, or hypothetically, if you were to get assistance for your parents, what type of assistance you would choose? For example, home health or assisted living?
It depends on the severity of what kind of care they need, I think. I guess home health would be a nice option, but usually tends to be kind of expensive. And if there's, in a case of Alzheimer's or a physical impairment, you probably need a little bit more higher level care, which would be better provided at a facility.
Okay, and are there any? This was sorry. Go ahead.
That's all right. I was just going to say I would look for some place they could live as independently as possible, but then gradually, as the facilities move into higher levels of care, as